Hi, my name is Addison Castles, and for my sports medicine 3 project number 4, I will be doing lumbar disc herniation and the rehab for that injury. So here are a few things you need to know about discs before continuing on with the surgery. Um, Discs' full names are called intervertebral discs, and they provide support in the back, and they act as shock absorbers while walking, jumping, running, many other things, so that the vertebrae do not clash together. They are made of annulus fibrosus and nucleus pulpus, and annulus fibrosus is made of lamelle, which is concentric sheets of collagen fiber, and the nucleus pulposus is water and loose collagen fibers. The annulus fibrosus is the outer ring of a disc, and it acts as a tire. It's more rubbery, it's more stable than the nucleus pulposus, which is more watery and a lot less firm. So a few types of surgeries are the open discectomy, which is minimally invasive. They just cut part of the disc out that is pressing on the nerve, or herniated, and they just make a small incision, no biggie. An endoscopic spine surgery is about the same thing, but they insert a tube that does almost the exact same thing as cutting off that part of the disc that's causing issues. The core of a spinal disc surgery is when they have to go in and remove the core of the disc because it is causing issues by pressing on the spine or other spinal cord issues. And then finally, there's an artificial disc surgery, which replaces a real disc that is either degenerated or herniated with an artificial disc. Um, and today we'll be observing an artificial disc surgery. So this is the surgery procedure. It takes about 2 to 3 hours unless there are complications, obviously. The doctors have to enter through the abdomen and move the organs and blood vessels aside so that they do not cause any other issues to the nerves, which are predominantly in the back, and also to the organs. Um, after that, they obviously have quite a few more steps, but to simplify it, they remove the current disc and replace the old disc with the new artificial disc, which will support the back and reduce pain, nerve pain, numbness, or any issues they have in that area. On the left side of the first picture, we can see a normal disc and what it looks like. On the right side, we can see a damaged disc, and then that bottom is just showing what the artificial disc looks like and how they put it into the back. Now we're moving on to the rehab. So for weeks 1 to 2, the guidelines are no extension on trunk twists for 8 weeks, no um, sitting for more than 30 minutes, no more than 15-pound weight, and that's towards the end of week 2, which is very unlikely. But the program basically for the first 2 weeks is very simple. It's just build up to walking 10 minutes a day, maybe 2 times a day. Focus on reducing pain and swelling, and focus on correct posture. And if you can, slight stretches of the quads, hamstrings, and hip flexors because those areas do impact the back. Obviously, weeks 1 and 2 are focused on healing instead of repairing the damage. Weeks 2 through 6 are all extremely similar, and the guidelines are keeping the spine in a neutral position to focus on neuromuscular control, which means when back surgery happens, you have to stay in a upright position and a correct postural position so that you do not cause any further nerve damage because that area is aggravated already. No progressing on weight or amount of time until there is great control and it is obvious that they have great form and they are doing completely fine, and then slowly increase the form when or weight when the form is correct. So the program is progressing with lower extremity / upper extremity movements, so marches, straight leg raises, upper extremity lift and lowers, and planks, mainly focusing on those abs and a little bit of arms because those will be easier, but abs to um, support the back because a lot of the time the lower back cannot be worked out as much as we want to. So those abs and that core really helps the back. And then, obviously, from range of motion and a little bit of strengthening throughout these 2 to 6 weeks, we are going to move to weight bearing, balance, Swiss ball, which is almost the exact same as a Bosu ball. Um, Weeks 2 through 6 are continued, and the guidelines are the same. Some more things that we can add to the program are hip extension, bridges, side lying clamshells, either with a partner or with bands, or just without anything, side lying abductions, and quadruped hip extensions. These are all basically just range of motion and a little bit of strengthening, but we can add weight, we can add bands to help progress and strengthen that back more. A few more things are step ups, leg press, wall squats, single leg stance, and tandem, um, which are basically a lot of building muscle and building back all that muscle we've lost after surgery. Some upper extremity light resistive exercises, which are like TheraBand, free weights, machines like rowing machine, and other things like that. And then stretching, obviously, because we want to keep those areas loose so that we do not have any cramping or muscle issues. So the hamstring, quad, hip flexors are really big. I think during this time too, you could maybe start rolling out your upper back. Um, Weeks 6 through 8, the guidelines are no extension of range of motion, and then no extension exercises for 8 weeks. So rotation exercises, excuse me. So no extension that are like completely as far back as possible. A little bit is okay, no rotation, because that will be extremely harmful until those 8 weeks. So you obviously progress to weight bearing, balance, all that stuff that I said in week 2. We just progress that. We begin running, agility, plyometrics, and return to sport at 8 to 12 weeks. This is past our program, but the doctor will determine whether they think it is a good time for them to return to the sport or not. Prone lying on elbows, press ups, and or gentle standing extensions. So that's a lot of more range of motion because we still need that range of motion, and that's also just agility. And then working on improving lumbar extension, range of motion, but avoid end range. So like I said, towards the end of that 8 weeks, you can start doing the extension, but end range means not going as far as you can, just slowly working up to that point. And so that is my project. Thank you so much. Also, I wanted to add that these discs usually last about 35 years, and they are recommended for people that are older and not as active because they don't do the best with sports and other things like that. But yeah, thank you for watching.